your normal tax bracket.
Into the next tax
Right,
bracket.
right.
We would continue up. And again, that, like you said, it depends on other income that's coming in. But yeah, that's the right thought process.
And where you live, because that's state though.
It's state. Indiana does tax it, yes.
Yeah.
Yeah.
Mm-hmm. Indiana does tax
Some
your
other
distribution.
states don't tax Social Security, but you still got federal taxes no matter how you look at it.
Yep.
But hey, I'm from Canada. Federal taxes here are not that bad. I mean, I know you guys think you pay a lot in taxes. You really don't.
Mhm.
Go to Canada and enjoy 60% tax rates.
You might get a little more benefits from that though.
No, you don't. Why do you think I left? What benefit do you get from a health insurance system that doesn't work?
That's right.
Well, we
That's why
are
we're
gonna
paying
talk about that.
60% into the government.
Don't go yet. So we're gonna go talk about Social Security and Medicare. Does anyone know where you go to get your information on Social Security? Because I remember everyone used to get those statements all the time.
Yeah.
And then now you gotta go on the website to get it. Does anyone know the website you gotta go?
That's it.
That's
all right.
SSA.gov or whatever.
And where's Medicare?
CMS.
Oh,
CMS.gov, isn't it?
What?
CMS.gov?
Nope.
Oh.
That's where you get the regulations.
He's gonna show you that. Go ahead. There's the two websites you go to get your information.
Medicare.
Okay, here's an important
Medicare.
question for you
Yes,
on
it's in
Medicare. For some of us grayer-haired people here who will continue to work past 65 for various reasons, what should we do about Medicare? Should we sign up for it? Should we?
Yes, we're gonna get on that in a couple
We're gonna
slides.
get on
You
that.
have-
And Lucas can
Yeah.
tell you more stuff about it, because we've done a lot of planning
Yeah.
and information about that when we do true financial planning for people, but, anyways, you wanna go to the next slide? We're gonna talk a little bit about Social Security, real quick. It is your monthly income. I know we're giving you a catch on this presentation, how to apply for it, but you wanna go to that. Or you can go to your local Social Security
Columbus,
office.
Indiana.
That's right.
It's in
Yes.
Columbus.
Yeah.
Or you can even go online. I know people that have done them online that have done it. If we're getting deeper and we're doing advising for people, we could run Social Security analysis to show you if you take it now versus later, when's that crossing point. We can do that for people to get deeper for their Social Security.
I still get a statement
Do you?
Once you get,
If you
twice
sign,
a year.
and if you sign up on the web, they take that away from you.
well, once you hit, I don't wanna say this
They
out
won't
loud,
send
but
it.
once you hit a certain age, they will start sending them again. But you've got,
Carrying
Yes.
your goal.
You
You
bet,
do.
you bet.
I think it's 60 or
After
62.
62,
Yeah, you start getting a
that.
statement
Yeah.
again.
Wait,
Yeah, I'm 65
I get
and I bring out one
I
in the mail.
get them, but if you, I went on
Oh,
the website,
yeah, I do them on
the
and if you
website.
sign up to look or
don't get
know
it.
officially what you're gonna
Yes.
get,
Yeah.
like if you retire tomorrow,
Yes.
then it will
They
be
stop sending it.
electronic
Yeah,
after that point.
right, but if you haven't signed up yet, then it's, yeah.
Yeah, which, you know, it's nice to get that piece.
So, yes, you
I like
can
it.
go to Social Security and you can do a lot of things and go see it. The impact of delaying your Social Security, just so you guys see, we do presentations on Social Security, but this is your current, and then that's what it'll be by delaying it. Can you see that?
Yeah.
I'm gonna come over there real
Yeah,
quick.
for all you young
Having
I'll
worked
put
in
it over there.
Canada, you
Yeah.
have to
That's
worry
your
about the
current time.
WEP. Which you know what that is?
And that's
The
your-
windfall
by-
elimination.
By
plan.
waiting a little bit longer. Which-
Because I will
Okay.
have Canada pension as well as Social Security,
So-
they will penalize me if I go too soon, if I don't work 30
If
years.
you want, I can throw it
70
here.
to 80 to 90, and then if you would.
This is where you go get, currently get
We
it.
just signed somebody from Canada as well, and she's doing.
And when you get past your normal retirement,
4%.
WEP.
Wait,
Okay.
Windfall
I'll write that down.
you're getting
elimination.
Social Security.
There's charts on the Social Security website that
Okay.
show you.
Yeah.
Okay,
So yeah, it's very rare that we run into that. That's good to know. Thank you.
so this is another topic we have with people. You saw that Social Security, once you get past your normal, there's an early at 62, and then there's normal when you get to 66 or 67, and then full retirement at 70. We have conversations with people when we're talking about this because Social Security starts growing at 8%. Do we want to delay that because your retirement is earning what? And if we can delay that, we can get more out of your retirement, your Social Security growing more than that from a financial perspective. I know what everyone wants to say. Everyone wants to grab Social Security because they want to get it and make sure they're going to get something and not deceased before they don't get it. But from a financial, we do have conversations around if we delay it, we know we're going to get a guaranteed 8% by delaying Social Security until we can take it, and we aren't sure you're going to get 8% of return because most people's risk aren't even there anymore. They've really backed down. So it's a conversation we would have with people, it's something to at least think about.
Will that hold true with our publicly elected politicians, where they won't start to whittle into what we in this room have already allocated it will be for years to come?
Well,
Is there a guarantee?
well, on your social security statement,
No.
on your social security statement, it says by the year 2034, it's gonna pay everyone still 100%. And at that point, they've already done some adjustments, they remove spousal, and if you were married 10 years, they've removed that off the table, so if someone that's been married 10 years can't get it anymore either. And they removed a lot of the spousal benefits. But if you, by the year 2034, if they don't fix it,
70
then
something.
everyone's gonna get a reduction. Now, that's a lot of,
Even those recipients at the time who were.
that's what they're saying, currently.
Yeah, that's what I-
That's a lot of voters that are gonna say,
Yeah, yeah.
HN or whatever, they're gonna say something, it ain't gonna happen, so they're gonna probably do some other things.
But the longer they wait to fix it,
Yeah.
Yes,
the more pain will be involved.
that's
Well,
the hard
yeah.
thing is that the
It's been a
politicians are
30-year
there.
thing.
They're in it for
Kick
4
down
years
the
and-
can all the time.
Yeah, that's exactly it. They're in there for 4 years, and that's 2034. You think they're not worrying about it too much
The
yet.
problem is that 2034, there's gonna be a huge
But
tax increase.
You could change it. You could ask them, Social Security could take more out and make sure that they're covering it. But that's another topic and another presentation that we do. You want to go ahead to the next one? A little bit about Medicare. Just go here. You want to make sure and be able to see when to apply. You had asked if
Yeah.
you're 65, should you apply?
So,
Even though I'm gonna work here probably
Yes.
for another 5 years after
You
that.
have to register.
yeah,
Yes.
so it's a good question. So
Yes.
if it depends on, I don't know your guys' healthcare benefits through here. So if they require you to sign up just for Part A, because then they'll say, the hospital will say, okay, we'll cover anything that they don't cover after that. But if not, they'll tell you, actually, you're fully covered through us. You'll just have to proactively decline, or if they reach out, you just decline all of Medicare if you're gonna continue working and take their benefits.
Does anybody
I thought
know?
we had to, I mean, if we still wanted to use our hospital benefits for healthcare as our primary, we could use Medicare Part A as secondary.
Yes, you could.
Yeah,
I'm saying if
yeah.
you wanna completely
Right.
use, yes. If you don't
What
wanna
about
do
Medicare
Medicare,
Part B?
You don't need that if you
Nope,
have our hospital
yeah,
insurance
exactly.
because
Okay,
it's
well,
covered through that.
it's only Part A that you would,
Right.
yep, that you would
Then
enroll for.
but what I don't know is whether or not you have to basically do your intent to sign up for Part B when you're eligible or not.
No.
I don't think you have.
So you would either proactively decline, or they would just say, okay, he's not signing up, especially if you aren't taking Social Security. Now, that's another
Oh, yeah,
story.
yeah.
You would have to proactively decline if you start taking Social Security, because
Right.
that, it basically triggers Medicare to.
I've
begin
got
to
two
do that.
reasons not to
Yeah.
take Social Security. One is that windfall elimination provision. The other is my wife is only 60.
Okay.
So I'm definitely not taking it until she hits 65.
So basically, all you would need to do at this point is just get with whoever your provider is, give them a call and say, hey, I'm getting close to 65, I don't want to take Medicare, I plan on still working, do I need to enroll in Part A? And they should tell you yes or
So
no.
that
You
would
should
be-
have to, I believe you do.
Yeah, so yeah, exactly, it just depends on the plan.
And then when you fully retire, you pick up the
Yep, you
rest
pick
of
it up.
You know, because my concern was if you didn't register or didn't say your intent was that you wanted to get Part B or D or whatever you're gonna do, that if you didn't do it within that time frame, you said you were eligible for A, that you couldn't get it later, but I believe.
If
I think
you're-
you have 7 months after you retire.
It's within 7 months, and they give you that time frame.
Yeah.
Like you said, that window, they just say, oh, you're still working, you're fine, but you do only have a certain amount of time, which I think it is 6, 7 months right after you retire, that you do have to enroll or let them know what's going
Or
on.
then you run into what, one of my patients, she's 70-something now, never signed up for Medicare Part B or D, I don't think. And now the cost is horrendous for her.
Yeah, you get hit with late penalties, and it is very expensive, like you
Yep.
just said.
And,
So-
and it never gets cheaper, it always gets more expensive. The longer you wait to take it, the more expensive.
So if you do wait until after you retire, if you're over 65, make sure you do it. It's one of the things you need to get done right when you retire, so you don't get hit with that late penalty.
Yep.
Mhm.
So the next slide, or really where we're really getting to the end, is the countdown to retirement checklist. And I think this is a nice piece that everyone should just have to review. It kind of captures a lot of stuff that you could think you're gonna forget. But it's talking about 3 months prior to, before 62, it's talking about Social Security, visiting the website. And then there's quite a few that says talk to financial professional, but it's really about making sure someone's helping you have another set of eyes, so you're not just trying to figure it all out yourself. 3 months before 65, you can apply for Medicare. 18 months, you can review your investments, meet with us, review your cost of living. Go to 1 year to talk about maybe talking to HR, getting information about the retirement policy. You really want to know really what's available. You know, when I leave, is my retirement plan, not my retirement plan, is my life insurance portable? Do I have any long-term care? What's still going to happen, or how long do I have once I do leave? Is it 31 days and everything's shut off? What do I know I have still in play and what I don't, so I know I can prepare to cover those things that I might need to still think what's important, if it's legacy or if it's long-term, and maybe start planning backwards to that. So we're trying to give you this nice thing of when I get there, and then what you should be doing is backing it up to you and saying, all right, what do I need to do to get to that point?
And within that retirement thing also, if you have a spouse that is gonna continue working, you will only have 31 days to make a change if you wanna get on their insurance. Just so you didn't know. That's called a life event, and it's usually only 30 to 31 days. And that happens at any age. It doesn't matter if it's retirement or you just stop working or change jobs. You only have 30 to 31 days to take advantage of that life event to get onto their insurance.
Or you have to
wait until the enrollment period, open
Yep.
enrollment, okay? So
Yep.
that always happens no matter what, so keep that in mind if retirement is on the horizon and you don't wanna do Medicare. And
What if you're bridging Cobra in that time?
Yeah, Cobra's 18 months.
Yeah.
Right.
It's
but-
extremely expensive though,
Yeah.
Yeah.
yeah. But yeah, Cobra will cover you for 18 months.
3 months, again, review your investments. We want to kind of help you check your beneficiaries. You always want to make sure you're up to date with that. It reminded me, someone said check necessary online accounts. I would say if you know you're leaving, a lot of people maybe don't have, their only point of contact is their work number and their work email. So you might want to make sure that you've adjusted some things, because sometimes they're going to shut that down and then you're going to be refighting to get back online again. Or connecting to the people that knew you from a certain contact point. So I would be really looking at making sure that I'm readjusting what I used to have as all my information and where it was and how to contact me, because we've had people that had plans with us and then they've left, and that was the only point of way we had
We
one.
can't get a hold of them.
Yeah, and you're like, I want to help you, just make sure you're in the right space, and your work email is gone and your phone number. And then the last part on the back side of this is really just talking things you should be looking at, working with HR, you know, healthcare coverage, intended retirement date, life insurance policies, things like that. If you had any pensions, I'll tell you this, if you worked at any places in the past, and I've been involved in a place that had pensions, if you're no longer active, they don't send statements, so you might want to be re-looking at places that you've been if you thought they had a pension, and just because you haven't got any information, don't think that you never got something there. Because a lot of places that I've been, if you weren't active, they just didn't send them, and you had them. Or go to Indiana, what is it?
I know what you're talking about, I can't remember.
Unclaimed money.
Unclaimed
Indiana,
money, yeah.
you might find that you
You can
have
find it
something
there.
on you
Yeah.
because
Oh,
of
yeah.
You can find it there,
They
yeah.
put it there.
yeah, it's real.
Yeah.
I mean, Indiana unclaimed, and you can find that you have pension money that was out there that they've had and they set aside, but they're not gonna call you unless you call them.
I don't wanna pay it out.
Exactly.
I've been an old
They're
plan, and
making
they will
money
still
on
chase
it.
me down for old pensions, and I say, yeah, you had one, I remember you, you need to call them to get it. And I'm like, why did they send it to me?
We used to have one of those things here at the hospital.
Yeah, but they paid us off.
They did.
Then meet with us. I think we might be almost done in our time. Make an appointment with us. We're here every other week. We'll move on. If you want to make sure we can talk about it. But really, what we want to go back to is, you know, looking at the moment for your retirement and estimate your income you need. A strategy of 4% is something, but I know we've had some debate about. That's just an idea. We can look more direct on yours and how much you're thinking you're going to need. Always need to be reviewing your investments to make sure that they're right with your comfort, your risk, and that we have the retirement checklist. I think that might be it. Lucas, I'm gonna pull you in front so people, if this is gonna be seen by employees, then at least they'll see us. And they know this is Randy Chin and Lucas Salerno. We're the two advisors. that come around
He keeps-
every other
It
week.
took two of you to replace Cheryl.
Yes,
Yeah,
'cause she
it
was so
takes-
good.
So it takes two guys to replace
Yes.
one woman, right? Exactly.
In my household, that's how it works.
I grew up with two sisters, so I think that's the best.
So, any questions for any of us?
I got a question about withdrawals from, like, say you kept the plan,
Mm-hmm.
in terms of, how do you take the money out? Like, you've got all these different mutual funds and accounts, you just take, like, is that a complicated thing?
No,
Is it easy?
no, when you have all those different investments, it all still comes out pro rata, it comes out equally. Okay, so you can
Unless
set
you
it,
wanna take it out of one specific thing, or you can't?
it doesn't, the only way we could do that is if we
You just
specifically charge,
adjust everything.
put it in an individual plan to get it to where we could then manage it.
So otherwise you just take a certain amount out, but you can readjust your asset allocation.
Yes, you can do that, you could set up
That was just what I just wondered how
monthly,
you did that.
you could set it up to take it up whenever you want and send in a form to do that. But it can be coming out however you think of it as a Bank of Lincoln investment, so you can get it however you feel like you want to take access to it.
Is it less expensive to do an individual plan and to do that?
No,
or it
we
doesn't
would
matter?
look at that and show you options and say, hey, you're telling me you want these things in your world, as far as maybe I want liquidity, I want low expenses, and I want some investments that maybe mirror the S&P or that have this kind of.
Like you don't have an
Platform.
ETF that mimics the S&P in your.
We can get into that piece.
Yeah, but not in the retirement plan.
No.
No,
That's what I'm talking about.
No, most employer plans, and they're wonderful, I mean, this one is just as good as, the ones I've seen that like I say, I've served the ones that have 12,000 employees. Just as good return on the investments and stuff, but they are very, straightforward, they're just a nice investment that you can put to grow it. And that, I'm big on mine, I wanna make sure and put mine in there, but the IRAs do give a little more flexibility for people.
But can you do an IRA before you retire?
After 59 and a half,
You can take that money out
you can
and roll it into an IRA.
Yes,
After 59.
yes, and I would say if that's an option, that's a consideration, we wanna talk to see about the
Right.
pros and cons for that.
Right.
To make sure that we're understanding what we're trying to choose to get
And
that.
mind you, you're still putting money into the retirement account.
You can't mix those 403s and 401s.
No, it's not, wouldn't be a 401, it would be
No,
an
no, no.
IRA, it'd be an individual IRA, I would think.
Yeah, he's talking about his piece of money, can he roll that? Well, yes, anyone could do that.
Say you had $500,000 in your retirement plan, okay, so tomorrow you say, I want to take that $500,000, roll it into an IRA and manage it like with more simple,
Whoever,
low expense funds.
Mhm.
But you're still working, so you're still putting money into.
And you can do that like however often you want, but most people just do it once a year at that point.
Yes.
Yep, you have the right mindset, yeah, you can do that.
No.
Do what once a year?
Oh, like they would just be like, oh, I'll just wait and do it once a year to transfer
roll
the
my
new
money
value
if I
that.
want to.
Oh, I
Because you
see, yeah,
contribute
yeah,
throughout
yeah.
the year. Yeah.
So
So you
you
can
got-
do it more than that, but I'm just saying,
Yeah.
just keep it simple so you don't.
But I thought you were limited on the amount you could put in every year to get to,
No, what you're,
whatever.
what,
Is
so
that
that's
different
really
than what
technically like a
funded?
trend, going from financial company to financial company, you can do as many as you want in a year. Is when a person takes that money, like I have money and I take it and then I roll it to an IRA, I have 60 days to get it back in without being a tax
Right.
penalty, and I get one of those a year. That's a different, that's a 60-day rule.
Okay.
But if you're not taking it, it's going company to
Direct
company,
transfer, yeah.
they don't care how many you do of those. You can do a bunch of those. Well, I have our, I don't think I have my card, and I know Lucas has his. I'll leave our. Alright.
Let me write the gym.
But,
I have 3, so I can't keep